Hi, I'm Tiffany Neighbors, and I work in the Communications and Marketing Department at Viva Health. I'm here to talk to you about health insurance. Health insurance covers your medical expenses if you get sick or injured. It also covers preventative care like doctor's visits, tests, and screenings to make sure you stay healthy. Health insurance doesn't always cover all your costs. In fact, it's designed to share costs with you up to a certain point, called your out-of-pocket limit. There are a few ways that health insurance companies might share costs with you, and it's important that you have a good understanding of your deductible, your co-payment, your co-insurance, and your out-of-pocket limit before deciding which plan is best for your needs. Generally, there are two types of health insurance: public health insurance, like Medicaid or Medicare, or private health insurance that you can get through your employer or healthcare marketplace. Let's break these down a little bit further. Medicaid is a federal and state health insurance program for low-income families and individuals. Medicaid has eligibility requirements that are set on a state-by-state basis, but it is primarily designed for those with low incomes and low liquid assets. It is also designed to help families and caretakers of small children in need. Medicare is a federal health insurance program for Americans above the age of 65. It provides free or heavily cost-reduced health care to eligible enrollees. You can type different parts of Medicare in the search bar on the Enjoy Life online page to learn more about Medicare. Private health insurance plans work by partnering with networks of healthcare providers. The most common are health maintenance organizations, or HMOs, and preferred provider organizations, better known as PPOs. HMOs ask you to choose a primary care physician, or PCP, that is a network. HMOs do not cover any out-of-pocket healthcare costs. HMO plans typically have cheaper premiums than other types of private health insurance plans. PPO plans typically give you the option of choosing between an in-network doctor, who you can see at a lower cost, or an out-of-network doctor who you can see at a higher cost. You do not need a referral to see a specialist with a PPO, but you may still be required to have a primary care physician, depending on your plan. PPOs usually have more expensive premiums than other types of private health insurance plans. When you shop for a health insurance plan, it's important to know what the key features are that decide how much you're actually going to pay for health care. These out-of-pocket expenses can be boiled down into 5 major features of your health insurance plan. First is the premium. Your premium is like your monthly bill. Every month, you'll pay a premium to a health insurance company to get access to your plan. While your monthly premium may be how much you pay for health insurance, it's not how much you'll actually pay for the total of your healthcare services. It's important to remember when choosing a plan that lower premiums will likely mean you'll pay more out of pocket if you need to see a doctor. Second is the deductible. A deductible is how much you need to pay for healthcare services out of pocket before your health insurance kicks in. In many plans, once you pay your deductible, you'll still need to pay co-pays and co-insurance until you hit the out-of-pocket maximum. Then your plan pays for 100% of services. Plans with lower premiums usually have higher deductibles. Now, deductible and out-of-pocket maximums are different. The deductible is how much you'll pay for a covered procedure before your insurance starts to pay, and the out-of-pocket maximum is the total amount you'll pay for care, including the deductible. The third thing you'll need to consider when shopping for health insurance is the copayment. A copayment or copay is a fixed amount that you pay for a specific service or prescription medication. Copayments are one of the ways that health insurers split costs with you after you reach your deductible. You may also have copayments on specific services before you hit your deductible. For example, many health insurance plans will have copayments for doctor's visits and prescription drugs before you hit your deductible. You will pay co-payments until you hit your maximum out-of-pocket amount. Fourth is your co-insurance. Co-insurance is another way that your health insurers will split costs with you. Unlike a co-payment, co-insurance isn't a fixed cost. It's a percentage of the cost that you pay for covered services. For example, if you have a co-insurance of 20%, you'll pay 20% of the cost of covered services until you reach your out-of-pocket maximum. Maximum out-of-pocket amount, or the out-of-pocket limit, is the most you'll ever pay for covered health care services in a year. Payments made towards your deductible, as well as any co-payments and co-insurance payments, go towards your out-of-pocket limit. Monthly premiums do not count. Health insurance can be very complicated. Making sure you compare apples to apples when you shop for health insurance is so important. Considering the total cost of your health care will help you make the best decision for you and your family. If you have health insurance through your employer, talk to your Human Resources Department about the types of insurance offered and the associated premiums and benefits. If you think you may qualify for Medicare or Medicaid, give our friendly Viva agents a call at the number on your screen to review your income level and other details. They'll be able to let you know if you qualify. Until next time, be safe and be well.